Hi, this is Dr. Avinash here, author and mentor. Welcome to my channel, and in today's video, I'm going to show you everything that you need to know about the facial nerve. Let's dive right in. The facial nerve is actually the seventh cranial nerve, and it's also the nerve of the second branchial arch or the second pharyngeal arch. Its main purpose is to supply the muscles of facial expression, but as we go through the video, you will very soon realize that it has a lot more things to offer, a lot more things to do. So, if you look at the facial nerve, it has five main components, functional components that you need to understand. These five main components are as follows. The first one is the special visceral component or the branchial efferent component. Branchial efferent or special visceral refers to the organs that are derived from the branchial arches. So here I am talking about the part of the facial nerve that supplies muscles of facial expression and elevation of the hyoid bone. The second component of the facial nerve, functional component of the facial nerve, is known as the general visceral efferent or the parasympathetic component. This supplies secretomotor fibers. Now, secretomotor fibers will of course go to the glands, to the submandibular salivary gland, to the sublingual salivary gland. It also has a component that goes to the lacrimal gland and glands of the nose, the pharynx and the palate. Okay. The third important functional component of the facial nerve is known as general visceral afferent. Afferent means bringing sensations, the messages of sensations from the periphery to the center. So all the glands that we mentioned, the submandibular, the sublingual, the lacrimal glands and all the other glands, their sensations are brought to the central nervous system via the general visceral afferent component, functional component of the facial nerve. The fourth functional component of the facial nerve is known as the special visceral afferent component. Special visceral afferent refers to the taste sensations that the facial nerve carries via a branch called as chorda tympani. And this branch carries taste sensation from the anterior 2/3 of the tongue, except from the circumvallate papillae and from the palate. Okay, so from the anterior 2/3 of the tongue and palate, except not from the circumvallate papillae. So these taste sensations are carried by the special visceral afferent. And the fifth and the final component of our facial nerve is general somatic afferent. This is where the facial nerve supplies the skin of the ear via a branch that passes through the vagus, and also some proprioceptive impulses from the facial muscles that pass via trigeminal nerve. And both these fibers, the general somatic afferent fibers, they report to the mesencephalic nucleus present inside the brainstem. Now, we spoke about the five functional components. Now, these components have to end somewhere, like they have to send the message into the brainstem. These endings, these collection of nerve cell bodies are called as the nuclei. Okay, so the facial nerve with its five components actually is referring to or communicating with four important nucleus that are present in the brainstem. These four nuclei are, the first one, motor or the branchiomotor nucleus, which lies in the upper part of pons, and of course the function of this particular motor nucleus would be to supply the muscles of facial expression. The second is superior salivatory nucleus, which supplies parasympathetic nerve fibers. Okay, and the lacrimal nucleus is the third nucleus of the facial nerve, which also supplies parasympathetic fibers to the lacrimal gland. The fourth important nucleus from where we get nerve fibers of the facial nerve is the nucleus tractus solitarius or the nucleus of the solitary tract. This is where the taste sensations end. This is also the place where the afferent from these glands that we keep talking about end. Okay, so facial nerve, seventh cranial nerve, nerve of the second branchial arch, nerve which actually has five functional components and four important nuclei. let's have a look at the course and relation of this particular nerve. For the sake of convenience, we are going to talk about this particular nerve in the following subheadings. The first would be origin, where does it start? The second would be an intracranial course, when it enters into the internal auditory meatus. The third component would be the course in the middle, in the meatus. The fourth would be in the middle ear, and the fifth part would be an extracranial course of what this nerve does after it comes out of the cranium. So let's have a look at all of this. The origin is very simple. It starts at the brainstem, where it has two roots actually. First root is called as the sensory root, also known as nervus intermedius, and the second root is the motor root. So facial nerve is attached to the brainstem by two roots, a sensory root and a motor root. Both these roots are attached to the lateral part of the lower border of pons. Lateral part of lower border of pons, just medial to the attachment of the 8th cranial nerve. Now once these two nerve fibers, two nerve roots actually arise, they run laterally forward along with cranial nerve 8 to reach the inner acoustic meatus, the internal acoustic meatus. And in the meatus, as you can see in this diagram that I have put up, the motor root lies in a groove of the 8th cranial nerve. And between the motor nerve and the groove formed by the 8th cranial nerve, there is the nervus intermedius. Also, as you can see in this diagram that I have put up, there are labyrinthine blood vessels also. Now, till here, the nervus intermedius, the sensory root and the motor root are different. But by the time they reach the bottom of the internal acoustic meatus, they combine together to form a single trunk. Okay, and of course this internal acoustic meatus is present inside the temporal bone. So we are talking about this trunk formation in the petrous part of the temporal bone. Okay, now once it crosses this internal acoustic meatus, it enters into the middle ear canal. Now as you can see in the diagram that I have put up, there are three parts and two bends that you can notice here. The first part is directed laterally above a structure called as the vestibule. The second part runs backwards in relation to the medial wall of the middle ear canal above this structure that you can see here called as the promontory. And the third part is much more vertical, as you can see. So it is going downwards behind the promontory. You will also notice that there are two bends that you can see in the diagram that I've put up here. These two bends, the first one, as you can see, is pretty sharp and it's more anterior superiorly placed to the promontory. This sharp bend is called as genu, and here the nerve is a little swollen, so we call it the geniculate ganglion. The second bend, as you can see, is much more gradual and it's present between the promontory on one side and the additus on the other side. Okay, now this entire thing that I am describing is happening in the middle ear. The nerve then leaves the middle ear by passing through a foramen called as the stylomastoid foramen. Now once outside the stylomastoid foramen, we say the nerve is now having an extracranial course. Okay, now in this extracranial course, the nerve actually comes out of the cranium and it crosses the lateral side of the base of the styloid process, and from here it enters into the parotid gland. The surface through which it enters the parotid gland is the posteromedial surface, and once inside the parotid gland, as you can see in the diagram that I have shared with you here, it runs horizontally forward in the gland and it crosses the retromandibular vein, and after it crosses that retromandibular vein, it breaks into 5 terminal branches. Okay, the first branch goes towards the temporal branch. The second is towards the zygomatic bone. The third is actually going towards the lips, so we call it the buccal branch. The fourth is the marginal mandibular, and the fifth is actually the cervical branch. So there are 5 terminal branches that you have to remember as far as this nerve branches are concerned. Okay. Now, apart from what I just said, the terminal 5 branches, there are many more branches that this nerve gives rise to. Let's have a look at the branches. For the sake of convenience, I am going to put it into 4 main categories: the branches in the facial canal, the branches at the stylomastoid foramen, the branches which are terminal branches, and some communicating branches. Let's have a look at each one of them. In the facial canal, we have the greater petrosal nerve, the nerve to stapedius, cauda tympani nerve. At stylomastoid foramen, we have the posterior auricular nerve, the digastric nerve, and the stylohyoid nerve. The terminal branches are temporal, zygomatic, buccal, marginal mandibular, and cervical. And the communicating branches are the branches that communicate between the first, second, and the third branchial arch nerves. So I'm going to put across some very important salient features of the individual branches, and it would be a good idea to take down notes of this particular topic. If you are actually writing it down, that would be great. The greater petrosal nerve carries the gustatory or the taste fibers and the parasympathetic fiber. This nerve, as you can see in the diagram here, arises from the geniculate ganglion, and it joins the deep petrosal nerve near foramen lacerum to form a nerve of the pterygoid canal. The second nerve is the nerve to stapedius, which arises just opposite to the pyramid inside the middle ear. It supplies that stapedius muscle, and it helps in dampening the excess vibrations that are caused by high-pitched sounds, so that our inner ears are not damaged if the sound levels are too high. The third branch that you need to remember is the cauda tympani nerve. Now, if you notice, the cauda tympani nerve arises from the vertical part of the facial canal, and it actually runs upward and forward in the bony canal near the tympanic membrane. And it leaves the middle ear by passing through a fissure called as the pterygotympanic fissure. It passes medial to the spine of sphenoid, and it enters the infratemporal fossa, and it joins the lingual nerve, through which it is distributed to the submandibular and the sublingual salivary gland. And this is where the taste sensation from the anterior 2/3 of the tongue are brought in. Okay, so secretomotor fibers as well as taste sensations are carried by our cauda tympani nerve. The fourth important nerve that you can notice in the diagram here is the posterior auricular nerve, which actually arises and ascends between the mastoid process and the external acoustic meatus, and it supplies the muscles at the posterior part of your head. So auricularis posterior, occipitalis, and the intrinsic muscle of the back of the ear, they are all supplied by the posterior auricular nerve. The fifth nerve is the digastric nerve, pretty short branch, supplies the posterior belly of digastric. The stylohyoid nerve, comparatively a longer branch, supplies the stylohyoid muscle. And then we have the terminal branches. The temporal branch supplies the auricularis anterior, the auricularis superior, some intrinsic muscle on the lateral side of the ear, the frontalis muscle, the orbicularis oculi, and the corrugator supercilii. The zygomatic branch also supplies orbicularis oculi. The buccal branch actually divides into two, an upper buccal and lower buccal. The upper buccal branch runs above the parotid duct, and the lower buccal branch runs below the parotid duct. And this becomes very important during surgeries of the parotid gland. Not to damage these nerves is vital. And the last branch we are describing is the cervical branch. This emerges from the apex of the parotid gland, and it runs downwards and forward and supplies this muscle called as the platysma. Now, if you know this much about facial nerve, you already are way ahead of many of the people. So, I hope you have taken down notes. The most important thing that you should do is share this video, subscribe to my channel, and click the bell icon so that you get notified every time I post a new video. And my videos are going to be much more frequent now because I want to build up on this particular channel, and I want to help as many people as possible with their anatomy, physiology, and biochemistry. I'm also planning to come up with certain live videos every week so that you can ask me questions or any doubts that you have. The next video that I'm going to post on this particular channel is the glossopharyngeal nerve, another very important nerve, and I don't want you to miss out on that. So please subscribe, share this video with your friends on your college WhatsApp group. Till next time, this is Dr. Avinash signing off. Take care.